Good afternoon, everyone, and welcome to today's learning exchange on leveraging technology to support population mental health, strategies to incorporate digital tools into mental health practice. My name is Carl Cabasel, and I am the HPCDIP Physician Lead at Public Health Ontario, and I have the pleasure of moderating today's session. Now, before we begin with today's presentation, I'll mention a few housekeeping items. To enhance the presentation experience, participant audio and video have been disabled. The chat pod has also been disabled to limit any distractions during the presentation. Please use the Q&A pod if you have questions during the session. And if at any point during the session you experience any technical issues, please email capacitybuilding, that's all one word, capacitybuilding at oahpp.ca. It is now my pleasure to introduce the speakers for today's presentation, Dr. Gillian Strudwick and Iman Kassim. Dr. Gillian Strudwick is a registered nurse holding the positions of Scientist and Chief Clinical Informatics Officer at the Center for Addiction and Mental Health, or CAMH. She's also an associate professor at the Institute of Health Policy Management and Evaluation at the University of Toronto and holds academic appointments at both Western University in nursing and the University of Victoria in health information science. In 2020, Dr. Strudwick became the first woman in Canada to become a fellow of the American Medical Informatics Association and was recognized by Digital Health Canada as one of the top women leaders in digital health. Iman Kassim is a project and research coordinator in the Digital Mental Health Research Lab at CAMH. She is an adjunct lecturer at the Institute of Health Policy Management and Evaluation at the University of Toronto. She is also the communications coordinator for the Ontario Nursing Informatics Group. She supports digital mental health research in the areas of population mental health, privacy, trust and consent, implementation sciences, and community patient engagement. I would now like to pass it over to Dr. Gillian Strudwick to begin the presentation.
Thank you so much, Carl, for the warm welcome, and thank you to everyone who has joined today's session. It is my pleasure to be here with public health professionals from across the province. So I will begin first by acknowledging where I am located, but also recognizing that we are throughout the province of Ontario and that the lands that you are on have their own unique and rich history. So I'm located in downtown Toronto at the Center for Addiction and Mental Health, which is part of Treaty Number 13 of 1805 with the Mississaugas of the Credit. And here I present to you some beautiful artwork by artist Lisa Boivin. So before we begin with the formal presentation, and we have lots of activities planned to engage you as well throughout today's session, I want to acknowledge that some of the examples we'll provide are from our research. And research is a team sport, we like to say, who have many contributors from various health discipline backgrounds. And we acknowledge our wonderful funders for making this work possible. So there are a few learning objectives for today. The first is to define digital mental health as it relates to and intersects with public health. The second is to understand the benefits and challenges in accessing or using digital mental health tools and data from a population intervention perspective. And this is where you'll hear about some of the examples that we can provide as sort of case studies. The third is to strategize methods that support successful use and adoption of digital mental health tools to support improvements to public health. And then fourth is to learn about and apply digital health frameworks, resources, and guides into public health practice. And we'll leave you with a list of resources that may support your own practice and your own roles. So let's get started with what is digital mental health? How does it intersect with the public health space? And really set up today's presentation so we're all on the same page. And so here I present to you quite a broad definition of digital health. So that is, the definition here is that digital health refers to the use of information technology, services, and processes to support healthcare delivery and outcomes. So this is really quite broad. It encompasses all of the different technologies that are listed on the right-hand side of the slide. And it's broad for a reason because it includes both synchronous and asynchronous care, or it also includes both clinical care, but also self-directed use of digital health technologies to support care. And what I mean by clinical care is that where you're connected with, say, a provider. And so as we think about the intersection with digital mental health, it's not surprising that it's when you start to deliver mental health services through the various technologies that were listed on the previous slide that we coin the term digital mental health. Now, much of the work to date in the digital mental health space has been, as you can imagine, at least throughout the pandemic, has been virtual care provided over the phone or via video. But there's a growing number of digital mental health apps, websites, and other resources in this space that are used for clinical care and beyond. And so what I will say about this space is that we're still in our infancy of this space in compared to other clinical areas or health domains. And so there's a lot of room for growth, but we do have a number of technologies and services that currently exist. And so here they are. Here's a couple of examples. And I'll say that we've chosen just a couple of examples because there are many. Even though that if you compare it to other areas of health, it's much fewer. And so when I was preparing for today's presentation, I went on my phone and looked up the app library. I typed in mental health, and I found it doesn't give you an exact number in the app library of how many hits, but I was scrolling for quite a long time when it came to mental health apps, and they were about a variety of different topics. So on the top left, I'm presenting a couple of these. Again, these are not sponsored. We don't necessarily endorse them, but really wanted to provide a couple of concrete examples. And so the PTSD Coach is an app that exists. And I know of an organization in Ontario that connects individuals with this app while they're waiting for services in a PTSD focused clinic. And on the right-hand side, the symbol with the clipboard in the middle is something called My Change Plan, and this is to support smoking cessation. On the right-hand side, we've got some of the phone or text crisis lines that have been around, many of them for a number of years. And then on the bottom, we've got some examples of courses or CBT type programs, and CBT standing for cognitive behavioral therapy, knowing that some of these are free in this space and some of them come with a paid component to them, and some of them have been developed by companies, whereas some more not-for-profit organizations. So there's quite a vast landscape in this arena. So where does this intersect with public health? So we've created this nice Venn diagram where you can see the intersections between the mental health and wellness space, the digital interventions that I just described, and then the population and public health space. And so the sweet spot in the middle is where all three come together, and that's where we refer to the digital mental health interventions that apply to the public health context. And you're likely very familiar with a number of digital health interventions that are specific to the public health context in that bottom arrow that may not have a mental health component, but are used in other clinical spaces or with populations. So interestingly enough, the use of digital mental health tools has increased significantly in the last couple of years, as has a number of digital tools in all areas of healthcare. This was initially as a result of using telemedicine, virtual care. You can refer to it in many different ways, as something called a digital PPE. So the digital personal protective equipment is a way of physical distancing and providing care. And it turns out that mental health and the psychiatric space lends itself quite well in many cases, and not all cases, to providing care in this in this way. Now, I will caution us in saying that there's still a lot of research that needs to be done to give us a sense of when this is appropriate, for whom, how often should care be done in person versus in a virtual manner. But these are all questions that we can work together with our various practices to contribute to the research in this space. And so there's not a one-size-fits-all answer that is a clear best practice in this space. So I bring us forward to our first discussion question, which is based on your public health or practice. Can you reflect on or describe an example in which a digital health tool may be used to support care? And this could be within the mental health context. But for those of you that may not have that experience, feel free to draw upon other areas as well. And I should say, I'm glad that we're having this conversation this week because you may be aware that it's Digital Health Week. And so it's a really great time to be having this conversation about what are the potential resources and supports that we could be using, and what are the best ways to actually select them and use them within our roles. And so I'll pause there to see what reactions, feedback, and thoughts you have related to this question.
Thank you, Jillian. We have a question in the Q&A pod. And by the way, folks, please put your questions in the Q&A or the chat pod. The chat pod's now open. Feel free to share your questions and I will read them out and pass them along. So we had something in the Q&A pod, a question, which is, are there any reviewed, endorsed, or validated apps? I recall years ago that CIHI, C-I-H-I, was reviewing some.
Yes, I can respond to that. And actually, we have a whole section of this presentation where we go into that. And I can provide some specific links to curated lists of apps that our team hasn't necessarily gone through, but respected organizations like the American Psychiatric Association have gone through and provided a list of apps that have specific criteria that they assess them against. So perhaps I'll say, stay tuned. We'll get to that.
Okay, another comment in the chat, the Lifeguard app. Are you familiar with that, Jillian?
I am. I came across this a year or so ago, and I think Iman is smiling, so I believe you have as well. My understanding of this app, and I don't want to get this wrong for the person that put this in the chat, is that for those who may be using a substance and want to have a safe place to do so with another person present, they're able to use this particular app and call emergency services if need be. And it's a way of being able to be in a safe space to do so.
Okay, excellent. So that was an example based on the question that you asked earlier. Can you think of an example in which a digital health tool may be used to support care? So yeah, the Lifeguard app. Another one was parenting supports, online courses, and delivery of programs via Zoom, as an example. Equitable access to care and accessibility was another comment. System navigation. So these are some of the points that have been raised. Do you have any comment on that, Jillian?
So my comment would be, I'm glad that people are thinking in this manner and thinking about the fact that there are some technologies that may support some of the work that they're doing within the public health sphere. Because I think sometimes we often think of the space as a clinician on the phone or on a video doing an exam, and that is in my view, a very sort of limited view of the potential use cases for technology. And it's great to hear that people have familiarity with them.
Yeah, so we have a couple more e-referral platforms like Oceans and the Alberta Family Wellness Initiative, Brain Story certification. So it sounds like people are pretty plugged in and have some really great examples here.
Great, and I'm not familiar with that one. So Iman and I can take note ourselves and look it up later. So thank you for sharing.
Everybody learns at our sessions, that's for sure. Okay, so Jillian or Iman, are we ready to move on to the next section?
Absolutely. So what I'll do now is pass it over to Iman for the next section, and then I'll join you a little later on in today's session.
Awesome. Thank you so much, Jillian. So I will be sharing some of the benefits and challenges of using digital mental health tools, specifically as they relate to supporting population mental health. And as Jillian mentioned earlier, we will also be sharing some case studies that exemplify these benefits and challenges in practice. So the first case study we are sharing is a rapid review that Jillian and I conducted in the summer of 2020, which aims to identify digital mental health tools that could be used to support population mental health during the pandemic. And the specific objectives of this study, beyond just identifying digital health tools, were to also identify what is known about the effectiveness of these tools, for whom these tools are effective for, and to also identify barriers and facilitators to the use of these tools in practice. So from the academic literature search, we found about 70 articles that met our inclusion criteria. And of these 70 articles, about 25 were primary studies that described the use of digital mental health interventions to support population mental health that were relevant to the COVID-19 context. And by this COVID-19 context, we referred to studies which spoke to natural disasters like earthquakes, hurricanes, forest fires, other medical pandemics and epidemics, and human-made disasters and conflicts. And so from our academic search, we didn't end up finding that many digital mental health tools that were described for public use. However, we found some pretty interesting results about the benefits and challenges of using these tools for a variety of different populations and within different settings. So some of the identified facilitators and barriers that we ended up synthesizing from the 25 papers were specifically in regards to some of the facilitators included having some sort of organizational tech support available really helped facilitate the use of these tools, especially by clinicians. Obviously, having access to the appropriate and adequate technology or devices or software to use these tools, both as a provider and as a client, facilitated the use of digital health tools. Having access to education and training about how to use these interventions, not only the interventions themselves, but also how to incorporate them into clinical workflows was really important. Virtual or digital health tools were found to be especially useful for specific forms of care, especially when care wasn't being able to be provided in person. And this was primarily in relation to mental health care services. In some instances, digital health tools reduced the cost of services, and this was primarily for individuals living in remote and rural communities. And also, one interesting facilitator of using digital health tools was that it allowed individuals to be anonymous and seek care privately if that's what they desired to do. Some of the barriers that we identified from our search was that there was some difficulty amongst clients and clinicians in using these digital mental health tools, which calls for a greater need for digital health literacy and education. As expected, there was also some voicing of mistrust of the different technologies used and the developers who developed these technologies, primarily as it relates to the security and privacy of their personal health information. And at the time of this review, which was early on during the pandemic, there was some legislation in the US that prevented certain forms of care, and this was primarily related to prescribing injectable opioids. As expected with digital health tools, a lot of them don't really talk to one another, and so there's issues with lack of data sharing, which causes silos. And in some of our studies, some of the clinicians expressed that they found it difficult to establish a therapeutic alliance or a therapeutic relationship between their clients that they had met only virtually. And so that was some of the issues with virtual care, was that it didn't sort of emulate that personal connection that in-person care would otherwise facilitate. And finally, there were some barriers in having adequate internet connection to facilitate the use of these digital health tools. So we also wanted to assess equity-related concepts related to the 25 primary studies that we had included. So in regards to relevancy to Indigenous peoples, just one study in our cohort of studies had adapted their intervention to meet the needs of First Nations, Inuit, and Métis communities. 3 studies addressed race, ethnicity, and cultural considerations, where some examples included adapting their intervention to fit a non-Western population. Others had their intervention available in a variety of languages, and other interventions offered translator services when required. 11 studies considered the socioeconomic status of their end users, where they provided free digital health devices to their users, or provided them with data plans or internet plans for them to use the device. Or they also just provided phone calls in place of video conferencing if their client did not have access to a smartphone, a laptop, or internet. And so 2 of the studies addressed sex and gender considerations, where in one of the studies, they had provided women who were victims of sexual abuse with the opportunity to receive mental health care anonymously and privately, as there was a great amount of stigma associated with seeking mental health care in that community setting. So overall, what we found was that not many of the studies considered health equity when designing, developing, or implementing their digital tool. And so in response to the importance of embedding equitable practices in digital health, 2 researchers at CAMH, namely Alison Crawford and Ava Serhal, developed a digital health equity framework, which the purpose of this framework is to help those wanting to use digital health tools in practice to first consider how using such tool may impact their patient population group and have impacts on the greater environment as well. So 2 interacting domains in the digital health equity framework that we thought would be most relevant to folks on this call would be 1, resourcing and quality of care, and 2, digital determinants of health. And so as expected, these 2 domains are very closely interlinked and intersect, where just as a person's environment shapes their healthcare access and quality, it also shapes their digital health access and quality too. So it's important to consider these 2 framework domains as well as the larger framework when wanting to use digital health tools in practice and determining for whom it's most beneficial for. So the second case study that we will be sharing is a provincial focused case study that we conducted in the province of Saskatchewan during the pandemic. So as some of you might be aware, the digital divide in Saskatchewan is highly apparent, where about 54% of Saskatchewan residents have access to broadband internet that meets the requirements of the Canadian Radio and Telecommunications Centre. And as you can see from the map on the slide, northern and rural Saskatchewan really lack reliable access to internet, where access to internet is primarily or predominantly available in 2 large cities, Saskatoon and Regina. And with the onset of COVID-19, this has further exacerbated the inequity given the rapid shift from in-person services to digital services. So in light of this, the purpose of our project was to develop a text-based intervention to improve Saskatchewan residents' awareness of and connections to digital mental health tools and mental health resources that they could use to support their mental health and well-being during the pandemic. And so we specifically aimed to co-design, implement, and measure the adoption of a 2-way texting service that we named SASquale. So SASquale is a very simple SMS service that just requires a cellular device and a texting plan to use. And the service sent weekly text messages to users directly to their phone, and users were able to respond to the prompts in the text messages. And the service connected individuals across the province to mental health resources and digital mental health tools available within the province and more broadly across Canada. And it also paired them with digital health tools that were reflective of their technology and internet access. So for example, if one of the users who signed up for SASquale did not have access to a smartphone and also did not have reliable internet access, we would match them with a digital health tool or a mental health resource that did not require internet access. Additionally, users received wellness tips and COVID-19 related messaging each week to support their well-being. So the following presents some of the enrollment data that we captured over the course of our about 1-year pilot of the texting service. And so as you can see, as the COVID-19 cases spiked in that 4th and 5th wave of the pandemic, enrollment in our service increased nearly 2-fold. And by the end of the service, we had about 710 residents from across the province from a variety of different cities and towns and areas enroll into our service. So we thought for this presentation, rather than focusing on the data that we had collected and the user engagement metrics that we captured, we thought it might be more interesting to present some of the lessons learned as they relate to the development and implementation of this text-based service across a provincial setting. So we categorized the lessons learned into people, process and technology, and partnerships. So in regards to people, we found that incorporating the insights of community stakeholders into our service was crucial in the success of the service. So we had a community advisory group of about 6 people who provided support on the design, the structure, the content of the service to ensure that it really suited the needs of Saskatchewan residents. And so that was a huge facilitator in driving the success of the service. One of the barriers that we experienced when launching the service was that it was in the middle of the pandemic, and we were limited to how we could recruit users to sign up for the service, and our recruitment methods were strictly virtual. And so reaching out to those in remote and rural communities was quite a challenge, given that we were really advertising the service on the internet, through different web-based discussion forums and on social media. So with regards to the process and technology, one of the most challenging aspects of creating content for the service was that Saskatchewan really does not have that many mental health, digital mental health tools and resources that are specific to the province. So unlike Ontario and BC, which are larger provinces and more well-resourced, and have a number of digital mental health tools that are freely available for their residents, Saskatchewan did not have that. So we relied heavily on our community stakeholders to help source information about content that we could include in the service. One of the success factors was that we were able to customize the service to the Saskatchewan context. And so as the COVID-19 environment changed and progressed over the course of the year that we had launched the service, we were able to adapt the messaging that we had sent out to users to ensure that it reflected what the COVID-19 state was in the province at that time. So for example, in the summer, Saskatchewan was reopening up, and there was some anxiety surrounding returning to normal. And so we had developed content and messaging to sort of help alleviate some of the anxieties, the feelings of anxiety that some of the residents of Saskatchewan had felt at that time. And finally, with regards to process and technology, we launched 4 iterative cycles of the service. And while doing this was quite time consuming and required a lot of effort from the back end, in the long run, it was very beneficial as we were able to build upon each iteration to ensure that it really reflected what users of the service wanted and that it reflected the needs of Saskatchewan residents at that time. So with regards to partnerships, we relied very heavily on our tech stakeholders, so the developers of the service, to support us in navigating the technology components of this text-based service. We come from a hospital and academic background, and so we were not well versed in what it means to obtain a short code or to develop contracts with specific regulatory wireless telecommunications officials. And so that was very helpful in this aspect. We also expanded reach by partnering with various community organizations across the province. And so this is what helped us with being able to reach out to folks in remote and rural communities, as we were able to partner with various organizations like libraries in those small towns to help spread awareness of this resource. And finally, building public trust was of utmost importance. A lot of our content was from CAMH, and I guess in Saskatchewan, not many folks are aware of what CAMH is, since it's an Ontario-based mental health hospital. And so we really relied on the University of Saskatchewan and other community organizations to build that public trust in this service, to let them know that it's not a private vendor who's developing these services, it's a public hospital and a university institution that's developing these services to support population mental health. And so I'll leave it at that. And Jillian and I will walk you through the next discussion section. Okay.
So thank you. We are going to do something a little bit different where we share our screen, but first I'll read the question, which is, what are some of the strategies or methods that can be used to support the successful adoption of digital mental health tools for population or public health initiatives? And so we're going to stop sharing this shortly, and Iman is going to pop up a Miro board or a Jamboard in which we can show you what the responses that are coming in look like. Another one came in, Iman, that's cultural relevancy. Another one is reducing costs of, and it escaped from me, data plans, I believe it was. And for cell phones. I know that's something in Saskatchewan that we had to get creative with, in particular for getting folks access to Wi-Fi. The next one is literacy, training, skill building. Reassurance of the legitimacy of the provider and the rationale behind the usage of whatever data is collected. Yeah, trust, there we go. I know you're trying to type fast. Another one is working with community partners to advocate for the tools. Another one is social media campaigns of the services of tools. Education and awareness campaigns, so more broadly. And I love this one, ease of use. I've definitely stopped doing things that I intended to do because they were more difficult than I imagined they were supposed to be. The next one is, awareness campaigns, yes. Data to inform decisions. Training the providers. I think this is a big piece. I know within, when I did my nursing undergraduate degree, this wasn't really a topic. We talked about how you provide education, of course, and link people with various interventions, but they weren't usually digital in nature. So shifting that conversation somewhat when you do have that conversation about digital, and there's all of these other equity pieces we need to consider. There's government to support a basic plan for all people to utilize online mental health. So support from government. I know that's a simplification of Natalie, the comments that you put in here. Oh, this one says word of mouth by, we're running out of sticky notes. Word of mouth by elders or trusted individuals. Building into stepped care models. So a lot of the things that folks are bringing up here are when we get to the next section and we talk about some of the tools and resources for how you select an app or a digital tool in general. These are some of the criteria that are often highlighted. So we're already thinking that way with the folks who are part of today's session. So many others that are brought up, including the link to schools, make the tools themselves more interesting than social media, multilingual translation, yes, scalability and access. So many really interesting comments here. Okay, I think we've got a full page here.
Yes.
And I know we could keep brainstorming, but I think what we might do, Carl, if it's okay with you, is head to the next section.
Yeah, before we do, can we just, there was one question that came in earlier. The question was, one of the barriers identified was difficulty establishing a therapeutic relationship with the client. Was that specific to a population or setting?
That was specific to a clinical setting. And so I believe it was from a study that launched transition from in-person care to Zoom over the course of the pandemic. And when they enrolled new clients into their care, the clients that they'd never met in person, they found it very difficult to establish some sort of relationship with them virtually.
Okay, thank you. So let's proceed.
Thank you very much. So I'll present this next section of today's presentation, which is about the application of digital health libraries, frameworks, resources, and guides, which I promised to talk about. And so often the questions we ask ourselves is, how do you actually select one of these digital health tools? As I mentioned when I was doing the prep for today's presentation, I found just hundreds of apps alone in this space, let alone the other tools we have to consider. So how do you actually identify one that's appropriate? How do you actually know if it's credible, effective, evidence-based? We don't have time as often as practitioners to be able to go through every single app. And there are organizations that have done some of that legwork for us. For example, Orca on the screen, and I'm not, again, we're not endorsing any one of these, but giving you a sense of the variety of the kinds of resources out there. So Orca is an organization based in the UK, and they do rapid certification of apps. So then you can go and look on Orca's website about the apps that have been certified and the various criteria that they use for certification. The Canadian Medical Association provides some guidance as well. And then both the American Psychiatric Association and the Mental Health Commission of Canada provide some advice for how, with some broad criteria that you might look for as either a provider, a family member, a public health professional, a patient, a member of the public, to actually go and select an app, the criteria that you ought to consider. And I'll go into some of that in a moment. Here's one example of what we call curated app library. So some organization has gone through a variety of apps and using a variety of criteria, done an assessment of those apps. And these are people that, or organizations that are not affiliated with the apps themselves. And so this one is called One Mind CyberGuide. It's based out of the US, so some, but not all of the apps that are listed in the CyberGuide are available in Canada, but they review based on criteria related to, say, credibility, the user experience, having a professional review done, transparency, and privacy practices as an example. So this is one example of curated app libraries. This next slide is some colleagues of ours that have created an app library as well using the APA, or the American Psychiatric Association app evaluation framework. So it's very psychiatric mental health focused. These researchers are based at Harvard Medical School and Beth Israel Deaconess Medical Center. And you can see there's a variety of different criteria that stemmed from the APA framework that are used to assess these various apps. And they have a bit of a crowdsourcing approach too, because you can actually nominate an app to be part of this and do a preliminary assessment. Of course, they'll do some checking of that as well. What they base the APA framework on are questions. So if you go to the APA, which is American Psychiatric Association, if you go to their website and look up this particular framework, they base their questions on key points related to 5 levels. So that first level being the background information, things like the credibility of the app and some of the costs perhaps, or advertising. Level 2 is about privacy and security of the data. Are there security measures in place? What is the privacy policy? What sort of personal health information is collected? The next is the third level, which is about the evidence base. Is there any clinical validity? Now, in this space, there are many apps that don't have a lot of evidence behind them. They could be built with great intentions, but they haven't had that rigorous study. Now, most of them are likely not to be harmful, but they could be a waste of time. And so looking for clinical validity is important. The next level is ease of use. So of course, this is about the user experience, but both in the short term and in the long term, because most users will use an app for a short amount of time, and then they'll drop off quite quickly and may not use it over time. And part of that may be due to the user experience piece. And then level 5, which is data integration, which includes things like who actually owns the data and where does that data get connected to. If someone has receives care with a particular health professional, does it integrate with the various health record system, as an example that they use? So this here, I'm not going to go through all the questions, but this here is a resource that the Mental Health Commission of Canada provides, which is the app checklist. So there are 5 broader questions with a series of checkboxes with some more focused questions underneath them. And so this would be for any individual, if there's a particular app that they're interested in using, that they can go through this. So the interesting, you can weigh the various approaches, whether you do the evaluation yourself or whether you rely on one of the curated libraries to tell you that information. There's different approaches to how you might actually assess an app. Now, we've been very focused on apps. This is where a lot of the guidance is present in comparison to some of the other tools. So I'll direct you to this last resource, which is, it started off on the left as a PDF in 2020 and has evolved to a web-based version, which is both in French and English. And this is sort of the central resource hub where you can find the list of all of the various app libraries that we're aware of that are related to the digital mental health space. And there was significant work in searching these out, as well as all the various evaluation frameworks that exist or tools to help identify appropriate apps or other digital tools as well. Although I would say the majority of this is really focused in the app space at this time. For those of you who are interested in this space and you were interested by this talk today and just sort of dipped your toe in the water of the mental health and digital health space, there's a lot more to think about than certainly that we could cover. It's certainly what we did today was more an introduction, but there's a digital and AI mental health certificate program, which has components like evaluating and using mobile applications in mental health care, which is free to enroll in through the Center for Addiction and Mental Health through our website. And so I'll just close off today in bringing this back to the public health space and saying that we know that there are many digital mental health interventions that already exist, and many of them, but not all of them, are going to be relevant to public health practice. The other thing I will just say and acknowledge is that digital mental health interventions are just one approach to supporting mental health and mental wellness at a public health and at an individual level, and should be used perhaps to think of as a complement to practice, but not to replace other interactions that are necessary that we know are required for certain individuals' health. And so I'll leave it at that. We'll go to the next slide just to say thank you. And I'm excited for the hopefully robust conversation we'll have and any questions that come in, and I will pass it back to you, Carl.
Well, thank you, Jillian, and thank you, Iman. We will now move to the Q&A pod to address some of the questions. So please continue to enter your questions into the pod, and if you've not already had an opportunity to do so, now is a good time. So let's start with, actually, there's already a question in the pod. Are there apps that are specific to persons with dementia?
So this, I am not familiar with a specific app, but I wonder, Iman, are you familiar? Because you've also gone through this.
One off the top of my head, but I know there's several organizations that are doing some great work in this space. I think McMaster Optimal Aging has some great digital mental health tools that they're developing for older folks. And then there's also AgeWell that has been developing some great tools in this space as well. So if you check out some of their resources, I'm sure they'll have some great apps that they can refer you to.
Excellent. Next question has come in. How do you keep the app libraries and other tools current?
Oh, this is the most difficult thing to do. And so we have shifted from using a PDF model to a web-based model so that there's an opportunity to actually update in real time. However, you do need people constantly looking and searching for things that are new, as well as doing that assessment and doing that update. So it does take some resources. The CyberGuide is a not-for-profit organization that has some resources behind it, as well as that group that I talked about at Harvard. They also have a team that supports this on an ongoing basis, as well as this idea of sort of a crowdsourcing approach where you can nominate, or you can say, I found this app, I think you need to include it in your database.
Okay. Next question. Can you comment on how users have found digital mental health tools to be effective or ineffective? I'm looking at some and they seem very self-motivated, which might be challenging for some users.
I wonder, Iman, did you want to speak first about SASquale, and then I can speak about our CBT, our internet-based CBT program, to answer that.
So for the SASquale project with the text-based intervention in Saskatchewan, we had conducted some user interviews to sort of understand why they wanted to use this tool and how it might have supported their mental health. And interestingly, we found, unlike what we found in the literature review, we found that SASquale was able to sort of bridge those personal connections when individuals were otherwise isolated because of the pandemic. And so that was one interesting finding. And while it wasn't a tool that was for individuals that had severe mental health conditions or illnesses, it was more so to be used as a preventative measure to support individuals in maintaining good mental health, so that it wouldn't continue to decline due to the public health precautions. There are other mental health apps that we use at KMH, like there's an A4I app A4I app, which is used to support the schizophrenia and psychosis recovery process. And that one is more to be used with a clinician and a client. And so that's been pretty effective in sort of monitoring how the client is doing and being able to sort of keep track of their sleep, their mood, and their journal items so that they can bring that up in care. And so in terms of sort of keeping that communication and continuity between a clinical consult and when they're home by themselves, it's been helpful in that sort of sense. Jillian, did you want to add about the CBT?
Yeah, I can add briefly about the CBT initiative that I was aware of. And so for folks who were on a wait list to see someone in person or through a traditional virtual care approach, a number of individuals were offered the ability to take an internet-based CBT program, and the dropout rate was quite high. Now, what was that to do with? Was it that it didn't meet their expectations in terms of what it was that was offered? Was it that it was now not at set times because it wasn't a synchronous offering throughout the whole duration of it? You know, there's many things that we can think about, and there's a team that's now looking into sort of the implementation of science aspect of that, of, you know, why it did or didn't work in the way it did. And also the other interesting piece is that it was thought that individuals who had, who are out of a way of making it as simple as possible to talk about, who had less symptoms and who deemed themselves sort of less ill with milder forms of, say, depression, who would be the ones that would be attracted to this. And that wasn't the case. It was the opposite of that. So people who were really feeling that they were suffering wanted to, I imagine, use something, anything, while they were waiting for their in-person or more traditional services. So I can offer that.
Interesting. Okay, we have quite a few questions in the queue, but there's still time to get your questions in. Next question: how can an organization or public health unit start to make connections with the appropriate community partners or champions to help with adoption?
This one, I think it would be interesting to hear what others have to say, because, you know, we might have some ideas, of course, of reaching out to partners, but those of you in the public health space, do you have some suggestions for your colleague? And Carl, perhaps you have some ideas as well.
Well, I'm wondering, you know, this is a great use of tech. Are there partnerships in the sort of tech world? Are there, are people paying attention to that user experience piece where, you know, how do we make this as easy an interface to use as possible, particularly with an aging population that has a great need for these services, but may not have that same facility with the technology itself? Is there sort of that gold standard approach to user experience in your experience?
I think it's developing. I think for all of us who use apps for all aspects of our in other aspects of our lives, I should say. We know that that experience varies significantly and we feel it, and that may actually be what keeps us sustained in using whatever it is over time. Within the app space specifically, now this is not talking about all digital mental health tools, I think we've seen great progress as we're starting to see more attention paid to engaging whoever the user group is really early on, and not just the content, but the look and feel, and then doing a lot of testing. And there's all sorts of interesting methods that you see used by the companies, by researchers in the development of these apps that we're starting to see more in the health space. Now, the limitation often is we have much less money than the big names that we hear in the tech space. And so that evolution of user experience is not quite at the pace that we would see for the phones that we're using and those kinds of companies.
Right. And so in areas where you may not have the same amount of connectivity or uptake of the technology, is there sort of an adjacent field of maybe more passive technologies like, video, maybe television, maybe radio, podcasts, things that demand a little bit less of the user, but might still have some benefit?
Yes, certainly. I think as Iman talked about in this the Saskatchewan example, given a lot of the challenges with access to internet in the province. And if you look at a map of Canada and you look at satellite-only communities, it's most of the country. It's just that our population, from a geographical perspective, most of our population is along the US border and has greater access than in rural areas. And so I think text message works in some places. And I'm familiar with a group that's doing, I don't know the details of this work, but doing some work in the north, and they are using radio, to your point. So I don't know the content that's described and used within that work, but they're using radio for, I believe it's an addictions related intervention that's being completed there.
Okay. So I think for this questioner who was asking about partnerships, champions, I guess it's a matter of assessing your local situation and then reaching out, creating those partnerships with both tech folks and other public health leaders, I suppose, in your community. Okay, let's move to the next question, which is barriers related to privacy impact assessment in individual public health units. Provincial, national direction or assessment would be helpful for different technologies and social media platforms to assist local PHUs, public health units. PIAs are time and resource intensive and cause significant barriers to using e-technologies for any public health work. So I guess that's more of a comment, but Iman, do you have any reaction to that?
I completely agree. I think it'd be very helpful for larger governments to sort of take on this work and conduct the evaluation of apps. And there's talk in the US and I think in some European countries about prescribing apps. And actually I stumbled across this German database the other day where they have a list of government apps that they've rated as medical devices. And so they've gone through that rigorous evaluation. They've gone through a privacy impact assessment to see what's going on with the use of the PHI, who's it being shared with, what is it being used for. And so I think having those types of curated resources at a government level would be very, very helpful, although I'm not sure that we're there yet.
Yeah, I was just going to say, how close are we here in Canada or even Ontario to something like that?
I can comment briefly on some work that the Mental Health Commission of Canada is doing, which is not, officially the government, but they're working with ORCA, who I introduced earlier, to do some app certification. Now, when that work will happen, I'm not sure when we'll get that list of certified apps and where it will sit, but I expect that it may be coming. Further to that, having certain apps considered medical devices. I don't know where we're at. It'll be interesting to see.
Indeed. Next question. We've got about 5 minutes left here. Next question is, how can we increase the use of these tools to help with surveillance or for potentially mitigating or avoiding potential public health risks, for example, in an outbreak situation? Jillian.
I can start, sure. So there's some really interesting work, and I think there's layers to this in terms of thinking from an ethics lens as well, into the preferences of individuals as it relates to their privacy. But there's some really interesting work in using social media, Twitter, Facebook, and other platforms to monitor mental health. And there's work out of Georgia Tech in the US. There's a researcher that specifically looks at how you can use social media as surveillance for various mental health concerns, specifically during things like when we had waves early on in the pandemic, as an example. And then after some tragic events, she can look at the local communities and isolate certain pockets of the community to look at social media. Now, how she does that, I don't know all the specifics of it, but it's very interesting what she's doing. And as I said, there's a lot of layers to unpacking surveillance, which I imagine is a conversation within the public health sphere all of the time.
Yeah, absolutely. I know here at PHO, when we're looking at things like healthy eating, for example, and have partnered with the supermarkets that do the loyalty cards, these supermarkets and other stores who do things like that are just sitting on mounds of data that can be really helpful. So at times it pays to get creative and to think about how do we gain access to understanding the behaviors of the people that we're trying to help and support. We have about a minute left. Let's go to the next question. I think having too many programs and apps will make it availability of programs, or make the availability of programs more complicated and limited in the scope of service. It would benefit greatly if the government or if a government-private partnership provided platforms for users and service providers to use a common platform. It will ease some concerns of data security and reliability, or programs and apps. So the idea of some sort of a commonality, instead of it being kind of a wide open type of situation. Has there been any movement in that direction to try to standardize this a little bit? I know these are early days, but surely somebody is thinking about that.
So certainly at the provincial level, there's efforts to support health information exchanges, and often that's done perhaps not at the app level, but in other kinds of digital resources available, like patient portals and that sort of thing. So I think there is a will at the government level, provincial level, and beyond. We have Canada Health Infoway at a national level to be able to pull a lot of this together under one roof, but it's very complicated to do so given the many players. And so I agree. It's very difficult to navigate in a world where there's so many different resources available.
Absolutely, but exciting days ahead, and I'm afraid we're out of time. So as we wrap up today's webinar, I would like to thank Dr. Jillian Strudwick and Iman Kassem for presenting. I would also like to thank everyone who joined us for today's PHO Learning Exchange. You can expect to receive a brief and anonymous survey for today's session. Please try to complete this to help us to improve our programming. And lastly, to access past presentations and view confirmed upcoming sessions, please visit the PHO website, head to Education and Events, and click on Presentations. So with that, I'd like to thank you very much and wish you all a wonderful day.